Good morning. I am Dr. J. Albino, Assistant Professor of Botany, Holy Cross College, Autonomous, Nagarkoil, going to explore the fundamental microbiology technique that is known as gram staining. So, before entering into the topic, can anyone say what do you mean by stain?
Ma'am, the stain is the dye that is used to highlight specific structures.
Yeah, you are right. Very good. Can you say what do you mean by dye?
Ma'am, I think dye is a colored substance that gives colors to the cell.
Wow, excellent. So you know the difference between stain and dye, and it is very easy for me to continue this class. Now let me share the PowerPoint. Please listen, girls. So in the first slide, we can see the overview of gram staining. Gram staining was first developed by the Danish bacteriologist Hans Christian Gram in 1884, and he was the first person to develop this gram staining technique. It is used to differentiate gram-positive and gram-negative bacteria, and this technique solely depends on the differences in bacterial cell wall structure. Coming into the principle of gram staining, gram-positive bacteria has thick peptidoglycan layer and very low lipids. But the gram-negative bacteria has thin peptidoglycan layer and it has high amount of lipids in it. Based on this cell wall component, while performing gram staining, the gram-positive bacteria will retain the color of first stain, that is crystal violet, and the gram-negative bacteria will retain the last stain, that is the final stain, saffronin. Hence, the gram-positive bacteria will be in violet or purple color, that is the color of crystal violet. The gram-negative bacteria will be in pink color, that is the color of saffronin. In this slide, you can see the reagents that we are using in gram staining. First is crystal violet. That is the primary stain that gives violet color to all the bacterial cells. Second one is Gram's iodine. It acts as a mordant. That is, it will fix the dye to the bacterial cells. It will form a complex, that is, first crystal violet and iodine. They will interact together and they will form a complex so that the cells will be dark purple in color. Third one is alcohol or acetone. It acts as a decolorizer. And this is the crucial differentiation step in this gram staining. That is, if you add too much of alcohol or if you add less amount of alcohol, that will lead to false result. And final one is saffronin that will act as a counter stain and makes the gram negative bacteria visible to microscope. Here you can see the procedure of gram staining. Actually, first you have to prepare a bacterial smear in the glass slide and the slide should be very clean. For this, we have to use inoculation loop. So with the help of inoculation loop, you have to take the bacteria and then you have to smear it in the glass slide. So after that, the first step is you are going to apply crystal violet. Add the dye and then you have to wait for 1 minute. After that, you have to wash it in running tap water. Then you have to add crystal iodine, that is for 1 minute. Again, you have to wash it in tap water. Then you have to rinse with alcohol for about only 10 to 20 seconds. Immediately wash with water and then we have to add counter stain, that is saffronin, and we have to wait for 1 minute. After that, wash in water and then observe under the microscope for your result. Can you understand this procedure?
Yes, ma'am.
Is it easy?
Yes, ma'am.
Okay, let's carry on. So, after the procedure, We are viewing this in the microscope. So we have to interpret the result. So the result must be, sometimes it may be gram-positive bacteria and sometimes it will be gram-negative bacteria. In case, if it is a gram-positive bacteria, you can see a purple or violet color in the microscope because of thick peptidoglycan layer in the cell wall. And in case of gram-negative bacteria, we can visualize pink color or red color cells. That is due to thin peptidoglycan in the cell wall. So these are some of the examples for gram-positive bacteria and gram-negative bacteria. In case of gram-positive bacteria, the examples are Staphylococcus aureus and Streptococcus pneumoniae. In case of gram-negative bacteria, the examples are Escherichia coli and Neisseria gonorrhea. These are some of the importance of gram staining. It is used to identify bacterial type very quickly and it guides the initial antibiotic therapy and it acts as an essential tool in clinical microbiology. So now, can anyone summarize today's topic?
Yes, ma'am.
Yes, proceed.
Gram staining differentiates bacteria into two groups. Based on the cell wall structure and dye retention, this differentiation takes place. It is crucial for diagnosis and treatment decisions.
Okay, hope you understand this. So this is all about gram staining and in next class, let us do the practical session of gram staining. Okay, thank you girls for your patient listening.
Thank you, ma'am.
Okay. Yes, acha.